So hi, everybody. This is Mo Lewis from the National Sexual Violence Resource Center. You are here today for workshop 3 in our series about sexual violence prevention during the COVID-19 pandemic. And today is all about handling disclosures in a trauma-informed way in online sexual violence prevention environments during COVID-19. This publication was supported by the grant or cooperative agreement funded by the Centers for Disease Control and Prevention. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services.
Thanks, Mo. So we have a handful of objectives. Just want you all to be aware of today as we go through this web conference. We're hoping that folks will be able to describe tips and guidance for being trauma informed when handling disclosures of violence, specifically in these like physically distanced online environments. We know that it's quite different in a lot of ways, and this also comes up with handling disclosures of violence too. We also want folks to be able to identify challenges and opportunities to a trauma-informed response to disclosures of violence, again, in this like weird, still new online remote prevention spaces. And then we also want to discuss the impacts of mandated reporting laws on sexual violence prevention and on promoting equity. So this is our legal disclaimer. You will see it again. This web conference is not able to offer legal advice, but aims to provide education. We definitely welcome questions, but if you have any questions about specific legal advice and specific legal situations, we welcome you to consult an attorney or your policy folks or whoever you have access to at your specific agency will be able to provide more of that legal advice. So just want folks to know the purpose of today's web conference is education and discussion, not legal advice. And Mo, you talked a little bit about our series at the beginning. I'm wondering if you have anything to add as far as like how this one fits in with our series.
Yeah, I mean, I think that one of the things that we've learned is how the COVID-19 pandemic is, I don't know, I just feel like it's wearing on all of our bodies and all of our souls. And even the way I'm thinking about it now is so different and changed from how I was thinking about it a year ago. And even thinking that it's been a year is like, oh my gosh. But we really wanted to come together and offer a space where people can really show up as you are, as you know, the uncertainties are happening, as we're all going through trauma in different ways, going through grief in different ways, and just have a space where we can learn from each other and figure out how we are making these adaptations. Even as things change, even as things have changed so much in this year. So our hope really is just to like figure out what our landscape will be like in a post-COVID world, and really what can we do now to prevent violence in the moment, and also what we can do to anticipate the necessary innovations that are coming down the road for our services.
I really appreciate you bringing in the, how are we going to deal with what's happening now, and how do we also leverage what we learned in the last year to create more equitable systems in the future too. How do we keep building that action and that momentum? So I really appreciate you bringing that to this space. I think that we have a tendency when we think about prevention to focus so much just on primary prevention. And, when we go through this web conference, I think it's important to keep in mind that, yes, we need primary prevention, but we also know it's super rare to be in spaces where there aren't survivors, and whether that's survivors of sexual and intimate partner violence, survivors of or co-survivors of the COVID-19 pandemic, folks are bringing it's hard to not be in a space where someone hasn't experienced trauma. And we also know that people may or may not disclose their experiences of violence online or in these online prevention spaces because the preventionists that they're interacting with through Zoom, through Nearpod, through whatever, that may be one of the few supportive adults that they have direct interactions with because of COVID-19. So we feel like the conversation we're going to have today is really important just for that, that sort of perspective too, that preventionists, advocates may be one of the few supportive adults that our youth have connections with these days. And then because we're going to be talking about, things like mandated reporting laws, I know this is a conversation that brings up a lot of feelings for folks, and can bring up a lot of, just like conflicting thoughts and ideologies. So we're going to be wading through the gray today. We're going to be kind of wading through that fog together. And just super encourage folks to, stay open to new ideas and to new perspectives and possibilities for the future too, as we talk about, some of these kind of complicated processes. And we're going to introduce our guests in a moment, but we also want to hear from you all if you have made a mandatory report before. Try to think of how that felt and use one word to describe your experience. And again, I just want folks to know that when we publish this text chat, we will take out first and last names of participants from that publishing. So like, for example, I'll show up as TV on the text chat transcript. And Mo, I see, wow, I see a lot of really strong words coming in through the text chat. I'm seeing a lot of stressful, I'm seeing anxious, worried, fraught, guilty, judged. I see some people saying, felt fine. What's coming up for you as you're watching these responses pour in?
Lots of like big, heavy words. Someone actually did write in heavy. Clearly, this is something that is not necessarily easy to do or feels really awesome for everybody. Those are pretty big feelings that I'm seeing, and I definitely relate.
Mm-hmm. Yeah, lots of big feelings coming up, and some of them are unsure, stressed, nervous, afraid. Some folks are saying like, I was able to collaborate with folks too. So thank you all for sharing so far. Now is the time where I'm going to hand it over to our guests. So first you're going to hear from Shannon Perez Darby, and then we'll introduce Emily in a few moments as well. Shannon Perez Darby is an anti-violence advocate, author, activist, and consultant working to create the conditions to support loving, equitable relationships and communities. With over 15 years of experience, Shannon Perez Darby centers queer and trans communities of color while working to address the issues of domestic and sexual violence, accountability, and the criminal legal system harms and prison abolition. So Shannon, I'm going to let you take it away. And then you wanted to share your own slides on this, right?
Yes, please.
Wonderful. All right. You should be able to do that now.
Wonderful. And then Tori, will you just give me a verbal confirmation that you can see the slides?
I sure can.
Perfect. Thank you so much. Hello, everyone. It's so nice to get to join you. So I just wanted to say just a couple of quick words of introduction. My background is that I worked with queer and trans young people experiencing a range of violence, so domestic violence, sexual violence, family violence, hate violence, in the kind of broadest range. And we had integrated programming where we were supporting young people experiencing violence while also creating the conditions to support loving, equitable relationships and communities, the conditions where domestic and sexual violence don't exist. And one of the things that came up all the time were finding ourselves in tension with our vision and our commitment to showing up for young people experiencing violence with the structural systems we had in place, especially mandatory reporting, and how not only what the legal landscape of mandatory reporting looked like, but how that was playing out, and continued to just be this ever-present thing when we were trying to show up for young people. And so this would show up in our direct services, but also like if I was going and doing a like relationship skills skills workshop with young people, almost every single time a young person would come up and disclose in the context of doing those sort of more prevention focused work. And so Emily will talk in more detail. So just to know, we're in these pieces are in relationship with each other. But for the purposes of this section, generally speaking, mandatory reporting is a state regulated system that requires certain professionals or people, including youth workers, domestic violence advocates, mental health workers, etc., to report specific harms by adults to people under the age of 18 years old, as well as certain vulnerable adults. So one of the things about mandatory reporting that sometimes can make it hard to define is that it is state by state. And so we have states in the United States that have universal reporting laws, which means all adults over the age of 18 are mandated reporters. In the state that I live in, Washington State, we have very specific laws that outline who is a mandated reporter. Usually that is connected to someone's like vocation, their professional, the work that they do. And it's just, there's a kind of complex landscape of what these laws are. So I'm not going to get into the specifics of the laws. I'm going to be talking a little bit more about how do we see the existence of mandatory reporting impacting support for our communities. So the concept of mandatory reporting was initially designed to respond to harm done to people under the age of 18 by adults. So the original envisioning of the system was to think about, were adults harming young people, and what should we do about that? And particularly seeing harm that adults were doing to young people, and having doctors, other folks know about that and take no action. And what we know, as folks talked about in the beginning, is that happens in the context of a world that doesn't, that needs to invisibilize domestic and sexual violence, needs to make it, that is an isolating experience where there is various kinds of, there's been a journey about how invested we are as a society in the kinds of harms related to domestic and sexual violence. And so this happened inside that context. And generally it was not designed with peer-to-peer and teen dating violence in mind. So it wasn't, the question that comes up all the time is, if two teenagers who are both 16, there's violence that happens between them, is that a mandated report? And to cut to the chase, it is often very gray and not clear, because most of the laws were not designed with that situation in mind. Most of the laws have a complex, vague, or just don't speak to that. So I want to just say that specifically, because when it comes to mandatory reporting, there's just sort of this fog. It's a fog. I call it the elephant in the room of youth work, which is that everybody sort of knows they're mandatory reporters. People get a real range of training. I have seen many, many folks who work with young people who literally get no training. My initial training was that I watched a video on a literal VHS tape of our previous attorney general, who gave, a 5-minute spiel about what mandatory reporting laws were. And that, was legally required that they show me that video. And that was the entirety of training I got about mandatory reporting when I started working with young people. I will say I have been doing this work around mandatory reporting and training and technical assistance for about 10 years now. And what I hear from people is that's people's most common experience, is that they get very little to no training about what mandatory reporting is, what aren't reports, what are your specific organization's policies, practices, how to think about that, how to talk to young people about that in any robust way. It is rare to have organizations that have that in place. So one of the things that I wanted to just ground this section in is this report. If you haven't gotten a chance to read it yet, I highly recommend it. At the end, there will be a link to where to go find this report. You can also just Google "There's No One I Can Trust," and it should come up pretty cleanly or easily. So there's no one I can trust: the impact of mandatory reporting on the help seeking of well-being of domestic violence survivors. And this report is a collaboration of the National Domestic Violence Hotline and the National Institute on LGBTQ Intimate Partner Violence. And so this report was administered to people who were reaching out to the National DV helpline was administered. There's a wait list kind of time often on the hotline, and so there was a survey that came up that you were welcome to take with these questions. So there were over 3,000 respondents that participated in this survey. And I'm not going to go through the whole report today. There's not time, but I do want to pull out a couple of really important things that we learned in this survey about the impacts of mandatory reporting on help seekers. So of the people that were asked or responded, nearly 1 in 10 participants said that someone they turned to for help reported what they shared to an official or an authority figure. When people were asked what the impact of that report was, 50% of people said it made the situation much worse. 12% said it made it a little bit worse. 20% said it made no difference. 15% said a little bit better, and 3% said much better. So over 62% said it made the situation worse, and the majority of people said it made that report made the situation much worse. So 1 in 7 participants were warned when reaching out for help that the person would legally have to report what they shared to an official or an authority figure. So only 1 in 7 people were told, if you tell me about these specific harms, I may have to report that. 6 in 10 participants said that that warning that they got changed what they decided to share. Over 1 in 3 participants said that they have not asked someone for help for fear the person would be legally required to report what they shared. So one of the things that sits with me and the takeaway from this survey and the other responses is there is this idea that I've seen over and over again that when it comes to mandatory reports, when in doubt, we should make a report. If we're not sure, go make a report. And it can have this idea that it's sort of this neutral act to make reports. And what we know and what we've learned from this survey and from other work that people are doing is that the act of making a report to the Child Protective Services or whatever that is called in your region, or the police, which is what is one area you often are required to report to, is not a neutral event. And I think people are understanding that more and more. I think, with the increased focus on the harms of policing and criminalization in this last year and the uprisings, I think people are becoming more acutely aware and more articulate of the racist nature of policing, and that it is not a neutral act to take someone who's experienced harm and share that information with the police. That is not something you should do lightly or without very thoughtful planning around the impacts. And that we know when we warn people about reporting, and so the best practice tends to be, if you share that you've experienced harm in these ways, I may have to report that to Child Protective Services or the police. You probably have some version of that spiel. And we know that that warning changes what people share. And when we know when it comes to sexual violence and domestic violence, that isolation is such a centralizing experience of that violence, that most survivors experience isolation, and that those are experiences that by the time they may be reaching out for support, you may be the first person they've told about that. So anything that we're doing that's sort of shutting down, that's closing down people's ability to feel like they can talk openly and safely in a contained way in a confidential way with somebody is impacting people reaching out for support. So we are learning and better understanding and that mandatory reporting can have this dampening effect on what we want, which is that survivors to get the help they need. So unintended consequences. So one of the unintended consequences of the system is that help seekers can be unable to safely access support. So you can see folks reaching out and then sort of being directed to these institutional systems and away from community-based systems. It can result in the over-reporting of parents reaching out for help. So we see this around conversations around domestic violence, and is witnessing violence and abuse between your parents a mandated report? In Washington State, we are lucky to have very clear guidance from our State Domestic Violence Coalition that witnessing domestic violence is not a mandated report in Washington State. But again, because the landscape is so complex nationally, we'll have to direct folks to your own, the work happening in your state. So we also understand that this mandatory reporting system is undermining the self-determination of people with disabilities. So not only when we think about young people and undermining and the paternalism of making decisions for them, but the adult protective services system has massive impacts on folks with disabilities and their ability to make decisions about their own lives and what happens to them. And we know it erodes the self-determination and confidentiality of people experiencing violence. So the anti-violence movement, one of the hallmarks of our work is confidentiality, is that we understand that people who are experiencing violence and harm should be in charge of the information about their own experiences, should have a say about what happens there. And we have a lot of things we have done to legally lock in that commitment to confidentiality. And how mandatory reporting currently works in many states is in direct tension with that commitment to confidentiality and self-determination, because in most places that report is required regardless of whether it's wanted by the person who's experiencing the harm, regardless of whether you as a worker who is an expert in your field with training thinks it's going to be beneficial. That those laws say you have to report regardless of whether you think it will be beneficial, regardless of whether it's wanted, which is in direct tension with this commitment to self-determination and confidentiality. So at its core, the impacts of mandatory reporting are that community supports lead to formal interventions. So what we know of what makes a good life is people need social connections, they need access to medical care, they need access to education, they need access to all of the things, to their spiritual communities and religious practices, and all of those things together make the net of support. And when we functionally deputize the community-based supports that then drive people into those systems, it erodes rather than builds support. So, and I see there's things coming in. Apologies for my, we will have time where we're gonna pause for sort of questions and some more engagement. So I see that there may be questions coming in, and I'm gonna push through for now, but I just wanna acknowledge that. So here in Washington State, we pulled together a coalition called Mandatory Reporting is Not Neutral, really looking at the impacts of mandatory reporting. The first part of our strategy is a conscious raising effort. So we have this campaign that you'll see here, really trying to help people understand what is mandatory reporting, what are its impacts, the ways that it can unintentionally harm communities, to help people sharpen their analysis around policing and around how policing shows up in social work and other helping fields, and that directing people as community-based resources to harmful systems is a part of policing. So helping people to understand and make those connections, and then really asking for some specific changes. So those are changes I'll speak about in a minute, and then wrap up. But one of the changes for us is changing and abolishing mandatory reporting laws and making a shift from the requirement to report to allowing reports when important and when there is a function that is beneficial to the person experiencing harm, but not mandating them regardless of the benefit. So I will wrap up my section with just a little bit of like, and then what do we do? So the first task is harm reduction. And I think it is so important to learn from all of our other parts in our fields and our kind of sister programs around how harm reduction works. So the first part is to understand your state's specific mandatory reporting statutes and to know when a report is or isn't being made. So one of the things is that, and Emily will talk more about this, you have a legal responsibility and a legal requirement to confidentiality in the work that you do. And that breaking that confidentiality is also in violation of your commitments. And so you over-reporting, making reports that aren't required, that aren't mandated, is breaking your confidentiality. So actually getting clear about what are mandated reports in your state, when a report is or isn't required. In my experience, many people are over-reporting, that they're over-reporting hunches, ideas, a vague notion. How we understand the mandatory reporting laws in Washington state is that you need to have specific information about the harm happening and not a guess. And so a guess or a vague idea, it does not necessarily trigger a report. And please do not over-report. So you are only allowed to break your confidentiality, your legal commitment to confidentiality when a report is mandated. Also, to clarify program practices around mandated reporting, it's very common for organizations not to have internal policies about what is a report, what isn't a report. Most mandatory reporting laws have a time limit on them, so the clock starts ticking when you receive information that may be a mandated report, and that should not be the moment you start figuring out what your organization's policies and plans and procedures are. I have seen it happen really regularly, that when folks receive that information, then there's a little bit of a panic of like, oh my gosh, who do we call? What do we do? What's the right thing to do? So practicing within your organization, working through scenarios, working through, great, well, when you have that information, you call your supervisor, you get together, you know, your group of people in your same confidentiality umbrella, and you talk through what's the best thing to do. You should always safety plan with anyone about whom information you are sharing with Child Protective Services or the police. It is very common for organizations and advocates to make reports and never tell the person who they've made the report about that the report has happened. I have seen that happen over and over again. I saw in the chat when we were going through earlier, someone saying that they had made a report with a young person in order to help empower them or give them as much information. So we would always want to be erring on the side of as much information and as much transparency, because the information belongs to the person who is your client or the participant in your program, and we should not casually share anything about people's sensitive and private information, especially without their explicit knowledge. And then don't do it alone and get support. We also want to reaffirm confidential opportunities for young people to reach out for support. So we have really locked in our commitments to confidentiality for adults, but in many places we have not paralleled that that commitment or that understanding for young people. So getting clear, what is the limits and the extent of confidentiality available to young people? There's often an understanding in different places about sort of a 13 and up or 12 and up, 12 to 18, and then an under 13 to 12. So getting clear about who your client is, the participant. So if that young person is your participant and they have thank you for that time check. And they have a confidential relationship with you, you should be not sharing information with their parents without their explicit consent. That's another thing that's really common, is to sort of think about that young person as your client, but then to share information with parents without the consent of that young person. So we should be extending the commitment to confidentiality to young people, and to clarify that, and then be explicitly clear about the scope and the limit of confidentiality, including your requirement as a mandated reporter in the work that you do. So this is part of the piece around the legal changes we are lobbying for in Washington state, which is to reinstate discretion in regards to reporting. So you'll often see in statutes, there's language around may and must. So you may make a report, allows you to legally break confidentiality, and must requires you to make a report. And so we can absolutely move to a model of discretionary reporting. So allowing people to break their confidentiality to make reports when we can prove that there is a benefit to the survivor, to the person experiencing harm, but not requiring it as a blanket mandate, regardless of the unintended consequences, regardless of the impacts, regardless of the desire of the person experiencing that harm. And that one of the things when I share this framework and discussion around abolition in relationship to mandatory reporting is people will respond to say, like, we need it, harm is happening. And so we need these because like young people will not get the help they need. And I want to acknowledge that all of this work should and is happening in parallel with robustly building up the supports for young people, not only experiencing violence, but doing the meaningful prevention work to create the conditions where everyone is robustly supported, has what they need, is connected to their communities, where we create the conditions where violence is rare. And so this isn't absent a parallel robust advocacy and prevention support. And that it also presumes that that making the report means support is available. So making a mandated report is just making a report. And there are a range of outcomes, including no investigation, nothing that moves forward, to the police showing up someone's house that night and removing them from their home. That's a very broad range of potential impacts. And we want to take into account that there is an active benefit, an active increase in support, that there is actually something that's going to happen on the other side, and not just assuming that just making that report to the police is a resource. Making a report to the police isn't a resource, it's just a report. And there are times where that increases resource, and there's times that decreases resource and decreases connection and makes people less safe. And so being able to take in the complex landscape of that in relationship to the communities you're working with, we know that police are not safe for many communities and are actively harmful to them. And so when we're working within communities of color, with Black and Brown and Indigenous communities, with queer and trans communities, with immigrant communities, the police are not inherently helpful to them and are often actively harmful. And so we need to take that into account when we are, as community-based advocates, funneling people into those systems. And finally, policymakers can abolish mandatory reporting laws and work with your legislators to help them understand the impacts of these laws and how we are proactively making a system of support for young people experiencing harm. We can issue guidance from member programs that clarify mandatory reporting limitations, and to sharpen your analysis on the inherently racist nature of policing. I will just finally say that, the vision is to center the self-determination of people experiencing violence, especially for people under the age of 18 and people with disabilities, and that we want to encourage engagement and connection over reporting. So reporting is just one tool. What we want is for people to be well connected and supported with the resources that they need. We want to reinvigorate advocacy tools such as safety planning. And we want to work to create the conditions to support loving, equitable relationships and communities, always staying connected to our vision of the world that we're creating. So I highly recommend folks checking out the Mandatory Reporting is Not Neutral campaign. It's easy, mandatoryreportingisnotneutral.com. And there's many more resources and context there, as well as a link to There's No One I Can Trust report. And then I will pause that, and thank you so much for folks for putting it in the chat. And this is how to get a hold of me if you want additional support. I offer training and technical assistance, and kind of help making policy and other kinds of things. If this brought stuff up for you and you'd like more support, feel free to reach out. And I will stop there and hand it back over.
Thank you so much, Shannon. There is a lot of affirmation coming up in the chat about, making a report to the police is not a resource, it's just a report. And I really like that your connection with, this isn't happening in isolation of all of the other supportive and preventative mechanisms that folks in the room are doing in their communities too. So I really appreciate the perspective that you brought to this web conference today. And I want to have a quick moment to introduce my colleague, Claudia. There was a question in the chat about, okay, so a lot of what Shannon was talking about was specific to Washington State. Where can I find what to do in my state? And Claudia, I think you have a really great resource that can help folks out with that.
Hi, yes, thank you, Tori. Hi, everyone. I'm Claudia once again, and I'd like to introduce myself. I go as pronouns she and her, and I've been working at Valor for a little over a year now. However, I began working in the movement at a local rape crisis center, and I worked there as a paralegal. For about 6 years, I provided legal advocacy to survivors of domestic violence and sexual assault. So now I would like to take this opportunity to share this resource sheet where I did some research, and I created a list of all the state laws where that you can go pull it up, and you can see information about mandated reporting state by state, since it varies from states to state. You could get topics on the child abuse, on what elder and dependent adult abuse mandated reporting is, domestic violence, and also state statutes for privacy and confidentiality protections. Since all states, they have different laws. This is a really good resource for you folks to go up and go in and check it out. I'd like the link is right here, and I'll put it on the chat as well so that you can just make sure that, did I share it? Make sure that I put that in there. I think it's a wonderful resources for everyone to have, and just make sure get all the, make sure I put that in there.
Claudia, Ashley is also supporting you with sharing the link in the chat.
Yes, I'm sorry, I'm not able to put it in. Okay.
No worries, folks have got it.
Great. Yes, it's on the slide as well.
Great. Yeah, super appreciate you bringing that resource together. That is going to be really great for folks, and you're getting a lot of thanks and smiley faces in the chat for that. Before Claudia introduces Emily, we have another text chat question for our audience. What would need to be in place so that people, particularly young people, have what they need to be supported and prevent violence? This is something that Shannon talked about in her presentation too, that when we're envisioning and imagining what more supportive laws would look like, and getting to that state, this is happening in parallel with the prevention and advocacy that's currently happening. So what would need to be in place in order to get to that goal, to get to that place of having more equitable, responsive, resourced systems? So just want to give folks an opportunity to brainstorm that. And then Claudia, I'm going to invite you back to introduce our next guest.
Sure. So we have Emily Austin. She is the founder and president of Pivot Advocacy PC. Pivot Advocacy PC is committed to community and institutional change for ending gender-based violence and promoting social justice through educating people within systems, developing supportive and in-house methods to confront and end oppression and harassment, and creating tools for the promotion of healthy communities, workplaces, and families. She works as a consultant to bring thoughtful, authentic change to systems, organization, and individuals to end gender-based violence. She was previously the Senior Policy and Advocacy Associate for the California Coalition Against Sexual Assault, who is now Valor. And while at Valor, she worked on improving system responses to sexual assault in such areas as college, university, incarcerated populations, and workplace. She identified as an activist from the age of 7 when she first discovered the endangered status of the blue whale. She graduated from UCLA with a BA in Women's Studies and English, and she also received her law degree from USC Gold School of Law. Following law school, Emily worked at the California Women's Law Center to improve school responses to gender-based violence, including direct representation of survivors and policy development. She worked at Peace Over Violence as Director of Policy, where she developed state legislation, researched child sexual abuse, created prevention curricula, and built community collaborations. She lives in Los Angeles with her partner, her 4 children, and her wonderful boxer. Please take a moment to meet Emily Austin. Thank you, Emily, for being here with us today.
Oh man, I always get so embarrassed with the bio thing. Good job. Good job embarrassing me, Claudia. Hi, everyone. I'm just want to make sure that everyone can see my slides. I'm going to move this. All right. Can everyone see my slides? Tori or Claudia, can you give me a...
Yes.
All right. So we don't have a ton of time today, but I wanted to start talking about this real practical approach to harm reduction that you can take in your agency right now. I think that what Shannon shared is that there are a myriad and multitude of harms that happen from the mandatory reporting systems we have in place. And we have conflicting responsibilities, both at the federal level and also with our state laws. And what I'm going to share with you is some thought practices, best practices on how to bring a trauma-informed approach to disclosures in an online and offline environment. We're going to talk specifically about within the online environment right now and some of the nuances of that, but also know that your policy and your practice has to extend to all the ways you connect with your communities. Again, I'm a lawyer, so I'm always balancing responsibilities as a lawyer with proper education, and just want to make sure that I can't definitively give legal advice in this platform. But our aim is really to build the conversation and start to ask each other those hard questions, because I can guarantee that in this participant list, in these colleagues that have joined us today, there is so much knowledge and experience that can help us make sure our organizations and our personal practices are as trauma-informed as possible around mandatory reporting. And I always want to urge you to seek legal advice, seek specific state legal advice for your policy and conditions. And then also, I want to encourage you to engage in this conversation about values and the role of confidentiality within your own organization, and figure out where you land on this spectrum of protecting confidentiality, and how you can be how you can live into those values to the highest ability that you can. Because this issue is pretty complex. No matter where your child abuse reporting laws or domestic violence reporting laws or elder abuse reporting laws lie in your code, they're representing an intersection of a lot of different systems. Statutes are housed in the legal system. That can be civil, it can be welfare and institutions. It is a very broad umbrella. We as organizations doing nonprofit anti-violence work are often seen as advocacy systems. We also, as Shannon highlighted, have this huge connection with mandatory reporting and criminal justice system. In fact, nearly all of the state mandatory child abuse reports either co-report to law enforcement or require a separate report to law enforcement. So one of the things that are built into these statutes is a close relationship with the criminal justice system that we know is not fair for all communities and has some real broken places. Next is our educational system. So I saw in the chat people thinking about how this means, what this relates to as being a responsible employee under Title IX and in campus world and educational systems. And that's a real consideration you need to be doing as preventionists as well. So how does this connect with my kindergarten to 12 program, my campus program? How does mandatory reporting work? And what are our organizational practices? And finally, service, housing, mutual aid systems. These are all intersecting platforms for this, they're support systems, but they're also intersecting within requirements to report. So I'll try and talk through these as I give best practices and we do some dialogue around what we can do to reduce the harm of these systems while unfortunately living within them right now. Looking just at the legalities, there's a lot at play here. There's child abuse and neglect reporting laws, which it seems from the chat and from our participants that people have had experiences with. If you're working with minors and if you're working with families, you may be aware of your own personal stories and stories of colleagues of how that interaction with whatever your child protective services, whatever your law enforcement agency is, and those reporting laws. But I also want to just open the door and encourage you when you're looking at policies and practices to expand your definition of mandatory reporting, to look at elder and dependent adult abuse, because I'm seeing that as a rise in mandatory reporting requirements. I'm seeing in California where I'm at, we have that as a mandated report under the civil code sections of the Welfare and Institutions Code. So that means that there's a mandatory report. It may not involve jail time or incarceration for failure, but there will be fees and penalties and requirements for certain folks to report elder and dependent adult abuse. The next piece is around the domestic violence arena and around violence, battery, assault, and firearms use. Doing research with Claudia around this, we're seeing that, maybe only 3 states from kind of some outdated research we saw don't have mandatory reporting of domestic violence correlated abuse. And many of those required reports are housed within healthcare workers. So it's an important thing for us to know as agencies that are working across issues and working with survivors that may have experienced various forms of harm, that we're aware that there are these intersecting areas of mandatory reporting, and each agency needs to be really clear. Each person needs to be really clear on what are those lines of mandatory reporting. But we also have this tension that was alluded to with the confidentiality guidelines from VOCA and VAWA, the Victims of Crime Act and the Violence Against Women Acts. And there is a strong value around protecting confidentiality. And our agencies and our work is called to hold confidentiality only all the way to the limit of what state law allows. So discretionary reporting could very well be a violation of this federal law, this federal landscape. And many of us, and that applies to not only direct grantees of VOCA and VAWA, but also to the subgrantees. So you may not be receiving money directly from these sources, but if you're a subgrantee of your state coalition, or if you're working with another agency that is, and you're receiving funds from VAWA and VOCA, even not directly, these guidelines apply. And then finally, pre-ultimately, state privileged communications and confidentiality laws. A lot of us advocates have already created robust levels of privileged communications. And it's important for you to understand what those requirements are and whether other forms of reporting, such as child abuse or elder and dependent adult abuse, intersect or supersede those state privileged communications. And then finally, we're in the era, we already were in the era, and now we're just really steeped in this technology, social media, using Zoom to provide direct services, using Zoom for educational purposes. And there are state and state laws that garner and protect, or trying to protect, those areas around social media laws, protections, restrictions, and creating HIPAA approved, FERPA approved, and other forms of protected confidential spaces. So I wanted to give you the actual legal sites, because if you just drop these into Google, you can pull up the actual statutory language. And also easily search for printed forms of the guidance that has come out from VOCA and VAWA, descriptions around confidentiality. Confidentiality is incredibly important for our work. And at the federal level, these state funds come with a requirement that you as an advocate not disclose or reveal, release any personally identifying information or individual information. So that is even broader than a lot of our state confidential communications or privilege laws. This is a huge umbrella of confidentiality. Personally identifying information can be up to 3 pieces of information about a person, such as city, gender, location of harm, or what office they came into. Those things can triangulate to create personal identifying information. It's not just knowing someone's social security number. It can be knowing the street they live on, the school they go to, and their gender or how they identify. So make sure that we understand this charge from VAWA and VOCA is to protect information that is not just not specific to harm. It's not specific to any certain checklist. It's this vague idea of personal identifying information. And I just highlight here because we're supposed to protect that information, even if we denied or did not serve the person whose information we collected. So it's beyond just protecting information for people that receive services. If people have requested services but did not qualify or were not able to be served, we need to protect that to the same amount. And the other thing that I find incredibly interesting in this work is that people don't understand or don't have policies in place to get a proper waiver of this information. So VOCA and VAWA really spell it out here that any waiver for disclosure has to be informed, written, and reasonably time limited consent for the waiver. So when we're going up against mandatory reporting, we need to recognize that we need to protect all personalized information to the extent that state law allows. That's the other part of VOCA and VAWA. So they have a general confidentiality protection that is very broad, but they do have a caveat that says that if state law allows or requires that disclosure, then VOCA and VAWA will not be in violation. As advocates and with the value of confidentiality, part of our best practice is to protect confidential information up to the level that state law allows. That's why this next part's really critical in thinking about the online environment, and also thinking through how confidentiality can be used, weaponized, and how we can be sure and be as transparent as possible within the online environment. The online and virtual environment differs, as we all are experiencing. I'm sure many of you are running maybe groups or doing educational workshops or even this webinar right now, that you're not in person. You're not seeing, smelling, feeling people in the room. You're often missing physical cues and body language. Like right now, I'm using my hands to talk, but you only see like my shoulders. So you're missing a ton of information my body is giving to you in just the way I normally communicate. Where you're also experiencing a strange moment in the development of trust. Being online, the trust can be impaired because people can easily disengage. They can be multitasking. They could be monitoring their text and their email and their social media at the same time as they're in your session or working with you. It can also be accelerated because of isolation. So just like Shannon mentioned, and I think Tori did too, is this can be a time of intense support and recognition of trauma And that can lead to very strong development of trust. You could be that only adult, that listening adult in that person's life, and recognizing that and keeping your professional hat on, as well as being transparent in your role, is going to be really important when things get blurred. This can also be seen in a blurring between like direct support, where you're doing a class or working with someone on Zoom, and then connection with their social media or direct messages through social media. So being really clear about kind of what the professional roles are and what the expectations are, I think will help serve survivors by not surprising them with a gotcha moment where you're stuck and your state law says you have to report, and the person you have to report the abuse about doesn't know or did not willingly step into that system. The other piece is, as mentioned at the beginning, just remembering that this is not necessarily a controlled environment. And that's really important for setting up and protecting privileged communications. If a privileged communication is not going to be happening in a room full of 15 people that are hearing your conversation, it's not going to be happening in an elevator when you have other, I guess that doesn't really happen with pandemic anymore, but when back in the day when we used to do elevators with multiple people in them, if you had a confidential conversation there, it would not be protected because other people were hearing it. There has to be an expectation of privacy for most privilege laws. So recognize that home and places where people are taking these calls or engaging in this education are not necessarily controlled, and especially working with minors or working with all folks, that they may not have control over the environment of who's listening in, of what's going on in the background, of interruptions or invasions, and persons that cause harm. The person that could be causing harm to that person could easily be in the house or just off camera and could be controlling the situation. So recognizing that the online environment, although it's really nice and easy in some ways, it's great to engage with, and it can lead to even deeper trust development. It also has some pieces that are dangerous for disclosures, or that endanger disclosures when they happen, and create conditions where individuals may be chilled and not be able to reach out for help even if they want to. So I think, we really do value confidentiality as an organizational, as a movement. The fact that it is in VOCA and VAWA really highlights that this is something that's not just based on a rogue agency. This is a core value to our work. So I would love to invite you to share some of the reasons I may not have said that we value confidentiality as advocates. And I'll monitor, I'll take a look. And Tori or Claudia, if you see anything that you want to read out, that would be great, just because I can't see the chat from this presenter mode.
Of course, Emily. So the responses are coming in pretty fast, but I think for the sake of time, because we do want to have you and Shannon have that discussion at the end still too, we might just read out some of the key themes at the end of your section. So okay. If you're okay, just, yeah.
I'll keep going. We'll get to the most important part. And also, Shannon did a great job of talking about the consequences and that mandatory reporting has impacts. What I think is interesting, aside to look at the impact on adults, is we aren't even necessarily knowing what the impact is going to be on elders and dependent adults. We're just now coming to terms with the negative impacts of child abuse reporting. So the consequences of filing a report go way beyond the report and often are not connected with appropriate resources. I'm going to just ask these two questions quickly that I want to see if you have had contact with your organization's policy around privacy and reporting, and if that policy includes technology explicitly. Just get an idea. Great. And thank you all for that really prompt piece. I think we have an idea of kind of where we land here. I'm seeing that a lot of you have experience with that policy, and that it's kind of like an even split, or there's some uncertainty of whether your technology is included in that policy. That's going to really highlight one of the best practices I'll share, that we need our policies to include the forms of technology we use. It's important to be clear. It's important to be transparent, and it's really important to know your role within the various forms of mandatory reporting, whether you yourself are a mandated reporter. And if you're not, you need to also understand who is a reporter in your agency. It could be that you as a volunteer, which is California law, is not a mandatory reporter of child abuse and neglect. However, anyone that supervises those volunteers is likely a reporter of mandatory reporter of child abuse and neglect. So your policies and your approach needs to consider who is a mandated reporter and make that clear, and make sure there's good training for those folks. But people that aren't mandated reporters need to also be trained and aware of the landscape of mandatory reporting in your agency. As a mandatory reporter and doing this work in general, you really need to know these 4 pieces: who is a mandatory reporter, what information is reported, how is it filed and where is it filed, and what happens next. And there's ways to be trauma informed in each of these moments. The first piece is knowing who is a mandatory reporter and donning that reasonable person hat. That's a legal standard that really goes around what is a person in your position feeling like there needs to be reported. Is it a reasonable suspicion of child abuse, a reasonable suspicion of elder abuse? And as an agent, as an advocate, you need to feel strong and committed in your professional expertise. My major piece on this, and if you take one thing away from this moment in this webinar, is that as advocates, we are not the investigators. We are not the persons making decisions about whether the abuse happened or not. We are not supposed to be figuring out whether this person is guilty of this crime or whether this thing has occurred. We need to use our reasonable standards and not gather more information or over-report or become an investigator. If there's a shorthand for this kind of piece, and it's bringing in this trauma-informed practice and principles, and ask yourself, when you look at your policy and your practice, how is it inspiring safety? How is it increasing trustworthiness? How is it providing more choices? How is it collaborative? How is it based in empowerment? And how does it recognize historical and generational trauma, including sexism, racism, experiences of some communities and some families? And finally, I'm going to kind of just end on these best practices quickly, just so you have a little bit of a roadmap on how to look at your policies and your practices. Be knowledgeable about your role, both what conversations are privileged and what those limits of privileged communications and confidentiality are in your state. Use that resource that Claudia put together as a launching pad, as a place to learn more about your state laws. Be transparent in the intersections of confidentiality and mandated reporting. If you are a mandated reporter, be sure that people you're talking to know that and what that can entail. And working with young people and building relationships, you may need to remind them, you may need to interrupt and say, I just want to remind you that I'm a mandated reporter, and that means that if you are caught being hurt, I will have to report this. It may chill language, but at least people will be stepping into a process that they'll be stepping into it with empowerment. Best practices: gather only the information necessary to do the job. Don't over-report or take on an investigative role. Gather waivers that follow that VOCA and VAWA guidelines. They're informed, written, and time limited. Have clear guidelines for disclosures at your center, and center choice and voice for survivors, including minors. Make sure you're having these conversations across the agency so that people aren't working in rogue or by themselves on whether it's a report or not. Anticipate the impacts of the report. So when possible, we urge including the survivor or the person to whom about the report is being processed when possible. Include them in that collaborative approach. Always assist in safety planning around the repercussions of reporting. And then be sure to make sure 40% of you were unsure of whether your policies include technology. Review those policies and protocols and run those scenarios. What if someone direct messages your agency on Facebook and discloses? What happens then? What is your policy and protocol? And don't do it in a vacuum. Don't do it alone. Make sure there's support, supervision, and a real organizational decision around where you land around reporting pieces. I've worked with several agencies. Some of them have not wanted to report anything and have tried to work around the state laws to prevent reporting as much as they can. Others have tried to balance the middle ground, and yet others have been over-reporting. So part of my work as a consultant is to bring people to their organizational values and make sure their policy and practice reflect that and follow the laws, especially that federal guidance that encourages and demands a level of confidentiality be respected in our agency's work. I'm going to skip the scenarios, but you have them in the printouts, but I want to just leave you with my contact and support information as well as we move into a dialogue.
Thank you so much, Emily. You really gave a lot of, tangible things that folks can do, both on their own or seeking support within their organizations. And I know from the chat, folks were saying why they value confidentiality. And I really want to uplift what Kristen said. They said it's a way to practice consent skills. And I think that was a theme that I saw throughout, that a lot of these principles of prevention were coming up in why people value confidentiality. So that was a really cool connection that I saw. We want to have time for you and Shannon to have this great discussion, but we also want to, before we send it back over to you both, we want to hear from our audience. So we've been talking a lot about, how we're working within systems that cause harm. We're also working in tandem with folks who are creating more equitable systems or have the prevention and the advocacy to build the systems in the world that we want. So we want to hear from you. How can you begin to move your visions for more equitable systems to action? And we're going to ask Shannon and Emily to provide their input over the next 5 minutes as folks are thinking about that question and responding to it in the chat.
Hi, Shannon.
Hi, Emily. Do you want to start?
Well, I want to kind of hold up what your campaign's doing, because I think that permissive language starts to build in this reasonable person, this professional expertise piece too, that I see as a legal connection to not mandating reporting, but creating systems where people want to seek support. So helping people step into systems where they get support and resources instead of taking away all that power and control by forcing them into those systems.
Yeah, thank you for that. Whenever I think about like, what is the world that I and we are trying to create, I always start with just like, okay, like imagining a human being in their home, in their place, in their community, and just like, what do they need? And just that that the world that we're trying to create should always be this sort of fractal piece where it's just like, it should work for that individual, and then we should be able to also scale it up or understand how it's going to work at scale for many, many people. And so, for me, that is like always strengthening community connections, always strengthening the people most impacted and like centering them, making sure there's equitable, appropriate resource for them, and that communities have brilliant answers and solutions for the violence that we experience. And that when we start with that question and build from there, like we know the answers. It's actually just like removing barriers is a lot of the pieces, and like proactively skilling up communities to build the world that we need free from violence, and that the like systems are often part of like are the violent thing. And so when we resource communities, that in some ways is the path forward.
I also think, you know, another piece of this issue is people's need to want to interrupt harm happening to children, and that's where the system grew from. And resourcing, engaging communities around conversations around these types of harm and making them feel confident and also part of the solution in ending violence against women, violence against kids, violence against all communities, sexual assault, domestic violence. A lot of the community organizing work I've done has been like, let's bring the conversation there. And that has a preventative and connective tissue that is part of the solution too. It's similar to what you're saying.
Yeah, I think some of the other things I are not always the most popular things, but I believe them so strongly, is really examining always our relationship to the professionalization of anti-violence work. That I do think some of the consequences of professionalizing the work is that it creates this idea that the solution to violence is going to happen through like workers that we reach out to versus through resourced communities where all of us are going to need the skills to both respond to violence as well as to be skilled up so make that violence is rare. And that actually the reframe from just the investment in our professionalization, which I think creates a lot of the tension about mandatory reporting, is the professionalization of anti-violence work versus having that live with communities, and really examining the anti-violence field's investment in policing in the criminal legal system, and how we have over-invested and how we have in many ways linked our what should be community-based and owned supports to systems of policing, and that we are continuing to reconcile and extract ourselves from those systems. But that constant sort of accountability and reconciliation, I think, is an essential part of the work we need to do to move forward.
Absolutely. I think I've been an abolitionist for a long time, and now is the moment. I think we can actually move I think change is really possible if we can keep focused on dismantling and changing some of these systems.
Awesome. Well, I know we are just about at time, so I feel that it's so nice to get to have such a lovely conversation with you. And I was saying for other folks to know, to Emily, as we were getting ready for this webinar, is that I've been talking about mandatory reporting work for 10 plus years, and it was so nice to find a kindred spirit who was like co-developing the same vision in another place. And so it's such a joy to get to collaborate with you in this one.
Thank you. Ditto to you, Shannon. Thank you.
Thank you, Shannon. Thank you, Emily. That this web conference really sparked a lot of imagination for me, and you're getting a lot of praise and validation in the chat too. So just wanted to let you both know that. Emily, there was a request to put your contact information in the chat. I don't think we have that slide on the link that we sent out, so we will update that and send it out probably around the end of the day West Coast time. Give ourselves a gracious timeline on that. So that concludes the web conference for today. I want to extend my gratitude and thank my co-hosts and co-facilitators, Mo Lewis at NSVRC, Claudia Cibaja, and Ashley Klein Jimenez with PreventConnect and Valor US. And of course, thank our guests, Emily and Shannon. This has been a really great conversation. I also want to thank our captioners at Aberdeen Captioning. Thank you for providing that service for us. And thank you to all of our participants. It was so great to get to connect with you all today. Mo, do you have any final words as we close out?
No, this was so great. Thanks for having me be part of it. I hope everybody has a good rest of your day.
Awesome. Thank you. Take care, everyone. This concludes today's web conference.